Hi guys. Um, it's been 2 weeks, I think, since I last did an update. And it's been an interesting couple of weeks. I have been struggling. Not so much with food. It's been hard to eat like I'm supposed to, but for the most part I have been, so that's good. Friday, so 4 days ago, I was sick, so obviously I didn't eat very well, but it's because I was sick, so I self-harmed again. And I had an appointment with my doctor and my therapist and my dietitian today, so it's been a long day. And yeah, I'll get to that in just a minute. Yesterday I had a job interview, and it's for a part-time test proctor at a school district, so I would go into different schools within the district and give these tests to students that are learning English as a second language. So yeah, that's exciting. It's only temporary, but I think that's good because it's been a long time since I've been able to work. So this is a good way to get back in to the swing of things. It doesn't start until January 20th, so I still have like 2 months before I will be working. But that's good. And it's paying for my trip to Disney World. Yay, I'm so excited. My one sister and my parents were going to Disney World in May, and I am super duper excited. I've never been to Disney World. I've been to Disneyland a lot, but I've never been to Disney World, so I'm pretty stoked about it. So this last week emotionally has been hard. Really, I guess the last 2 weeks, even though my doctor had increased my Prozac so that I'm on 40 milligrams instead of 20. It's still been rough. And I haven't been sleeping. Like Sunday night I got like an hour of sleep. So that's not helping with the depression at all, because when you're exhausted it just makes everything worse. So I've been struggling with the sleep and suicidal thoughts and self-harm urges and exercising urges, so yeah. And this week is Thanksgiving, so that adds a whole new twist to everything, because I know I have to eat, and it just seems like people have to gorge themselves on the holidays, and I don't know why I have to. I'm not going to restrict, because I talked with my dietitian about it. I know exactly what I am going to eat, and it's just like the amount that I would normally eat, because there's no reason to eat a huge amount of food just because it's there. I understand that, like, it is an eating disorder to eat large amount of food, so I get that, but just because it's a holiday, just to do it, there's really no reason to do that, and I don't want to have to do the starve before the famine. I mean, like, I don't want to have to starve because I'm going to eat this huge amount and then have to starve after that, so I just am going to eat the portions that I need to eat. So I'm not as concerned with the food as normal, we'll see how the day actually goes. It might be different when it actually gets there, but for right now, I'm okay. But we're having Thanksgiving at my house this year, so I have 2 older siblings that are married, and then 2 other siblings that aren't. But my 2 older siblings are married, and they each have 3 kids, so they're all coming over, and our house is not big enough for that. So there'll be a lot of people in a little space, and that will be hard to deal with. It'll get very chaotic, and I don't handle chaos very well. So it's supposed to be nice here on Thanksgiving, so at least we can go outside. So hopefully that can alleviate some of the tension. So I went to my doctor this morning. I showed him the self-harm, and he had actually talked with the main doctor at that clinic. The main doctor at the clinic that I go to used to be a doctor at the Center for Change, so they do really well with patients with eating disorders. They know how to treat them and like what kind of meds to put them on. So that's a really good place for me. I love my doctor. I love my doctor. He's so good. Like, I can tell he's genuinely concerned about me and he cares for me. And I've never felt like that from a doctor. It's not in a creepy way, just in a good way. Like, yeah. So he had talked with the main doctor there, and because the Prozac or fluoxetine isn't working really, they gave me, I don't know if it's not working or if I just need something else with it, but they gave me something else to go with it for right now. It's called, oh man, now I can't remember what it's called. Seroquin? Something like that. I can't remember exactly what it's called. I'll have to go look. It's kind of a more expensive medication, but it's supposed to help with anxiety, depression. It does help with bipolar, but I'm not bipolar. And insomnia, which is good because I need sleep desperately. And it does increase my appetite, which kind of makes me nervous because I don't want to like overeat, but at the same time it's good because I have like no appetite at all. So it would be helpful to actually have an appetite so that maybe I actually want to eat. So hopefully that works. Basically my doctor said if this doesn't work, then I have to go to a psych ward. So I really don't want to do that. My options are back into the center, but this time as an inpatient. But that's like, that would be like the very, very last option because my insurance won't pay for it, and it's very expensive to be inpatient. So then there's Provo Canyon Behavioral. So I'm not sure how I feel about that. But that would be an option, and then back up to the University of Utah Psychiatric Hospital. Not so keen on that idea either. And then what else? Oh, just like a psych ward in like just a regular hospital. And that would probably be one of the first options because my insurance will cover a psych ward in a hospital. But I don't think that's what I need. I think it would stress me out more. And I really don't want to have to go there. Yeah, I don't want to do that. So, that's where I'm at. And when I talked with my therapist, she was concerned for me, and she said for right now she's supporting the decision not to go to the hospital. And obviously she can't force me to go to the hospital because she's not a doctor. But my doctor, if he felt like I needed to go to the hospital, he could let me. So I really don't want that. That would not be so good. Yeah, let's not do that. And I talked with my dietitian and told her what was going on. I told her that it's been hard to get my 3 snacks in. So she said that if I wanted, I could have an extra side at breakfast, because right now at breakfast I only have to have 2 sides, and lunch and dinner I have to have 3. So if I did 3 sides at breakfast, then I would have to have 3 snacks. So that's an option. So we're just going to have to see how this week goes, and hopefully I can find appropriate coping skills. I am going to a new group. It's called DBT, Dialectic Behavioral Therapy, or Coping Skills. So that's one I went to when I was on day patient. And it's good. It's kind of boring, but the material is good. So going to that, I'm not going to my balance and mindful eating class anymore because there was a girl in there that was just super triggering, and basically they told me that I just needed to talk more. Like, they weren't going to stop her from saying stuff that, and she was saying stuff that if you were like on any other level of care, they would tell you to stop talking about that. So that kind of bugs me. So that's where I'm at. Hopefully things will get better. Hopefully I'll have the desire to get better, because right now it's kind of comfortable. I'm not gonna lie. So we'll just have to see. Thanks, guys. Bye.